If you have treatment-resistant depression, you should know about TMS. TMS is transcranial magnetic stimulation. We're using magnets to activate very specific parts of the brain. TMS is what's categorized as non-invasive procedure. This is not a surgery. You don't go under anesthesia. They're not making cuts into your body. It's using magnets outside of your body to activate a part of your brain, and you'll be awake for the entire thing. It's non-invasive. People with depression typically have a lower level of activity in the front part of their brain. TMS was then theorized to say, if we stimulate that, will that increase the activity? Will that actually help them come out of depression? It's been studied with different protocols, but it's shown to really help people come out of depression, especially depression that's not responding to medication. If you were going to go to get TMS, if you talk to your doctor, how would it actually look? There are different kinds of protocols, but the most common one would be over 6 weeks. If you're in an outpatient setting, you're living at home, you would be going in somewhere close to 5 days a week, close to half an hour each time. They would be putting a magnet up to your head, turning it on. You would be awake during this whole thing. You wouldn't feel a whole lot, maybe some itching, muscle twitches, things that are fairly mild. You'd be able to go home, you'd be able to drive. You wouldn't have to change your whole day around it, and you would go on with your day. You would do that over the course of 6 weeks. And after doing that, that part will start to become more active. It will start to have what's called neuroplasticity, which means kind of growth and new activity in the brain and more connections to other parts of the brain that seem to be helping you recover, helping you regain your life and move on from depression. So who do we actually pick for TMS? And this is where we talk about the category of treatment-resistant depression. These are people who may not have responded to several of the medications that we typically use for depression. In working with your doctor, they would evaluate why things aren't working, if there's other things that can be done, and if you would be a good candidate for TMS.